So good morning, good um, good afternoon, good evening. It depends where you are. And so today we are going to have a beautiful and powerful discussion uh, in our Planetary Health Coalition. We are going to have Alina and Ellen, both powerful women that are doing amazing work around the world, especially in Africa. And so the relationship between woman and planetary health is more than obvious for me. I hope it gets obvious for everybody in the end of this discussion. So I think you are going to start, Alina. So everyone have 15 minutes, then we open for the discussion and for the Q&A. So, Alina, I think it's better if you can introduce yourself because you do so many things that it's even hard for me to introduce you.
Thank you very much. My name is Alina Pelka. I am the founder and president of the board at YORGHAS Foundation, a non-profit, non-governmental organization established 6 years ago. It's headquartered in Poland, in Warsaw, with its regional office for Africa, located in Lilongwe, Malawi. However, I think this is my main role that describes me the best way, because of course I'm also entrepreneur. I have experience in business and education, but my humanitarian work is really something that drives me. It's my passion, and this is the first position I would like to highlight. And this is my work and my passion at the same time. So first of all, thank you very much, Renata, and everyone, wherever you are. Here it's evening already in Poland, but I know it's morning there. So good morning, good afternoon, good evening, and I am really very proud and honored to speak and to talk with all of you about the important role of women in creating sustainable solutions for the planet, with a particular focus on their health, on their well-being, and the ways in which we can center community-driven action in tackling global challenges. All what we do in YORGHAS Foundation is women-centered. From the day one, we focused on women's health in developing countries of Africa. So far, we have worked in Tanzania, in Uganda, in Nigeria, in the Gambia, and in Malawi. And since 2022, we have been rooted there very well, because we opened our regional office. We registered also our organization in Malawi. So we are a legal entity working there. We got a status of international organization working in Malawi. Today, I would like to share some powerful examples from our work in Malawi and across the continent, about the projects that are showing how community-centered solutions and women's empowerment are essential for building a more sustainable and equitable future. At YORGHAS Foundation, we believe that sustainable solutions are best built from the ground up. To make a long story short, all what we do is not our idea. It always comes from the ground and comes from grassroots level. It is always a request of the local community. So one of the key areas we focus on is supporting women and well-being, as I said, particularly in areas where women's access to basic needs is very limited. I would like to focus on examples of projects that will show how we work together with women to improve women's well-being and healthcare, and create sustainable solutions. However, the first pillar of our work is maternal mortality, maternal and infant mortality. It was the first point from which we started. But I would like now to present maybe another issue, a very pressing issue, which is period poverty. As we probably all know, period poverty means a lack of access to personal hygiene products, sanitary pads, but not only. It's also a lack of basic knowledge about body, about our biology. It is also lack of water. It is also lack of access to toilets. So it is a very complex problem, which can cause very severe results and has very serious impact on girls and women's lives. So in Malawi, it's estimated that around 75% of girls doesn't have access to personal hygiene products and knowledge about menstrual health. So to address this, YORGHAS Foundation created a program on menstrual health and hygiene project in Malawi, focusing on providing affordable and sustainable solutions for women and girls in rural communities. We partner with local women's groups to produce reusable sanitary pads, which are made from locally available materials and sold at affordable prices. So beyond providing sanitary products, we also conduct education campaigns to reduce the stigma surrounding menstruation and raise awareness about the importance of menstrual hygiene and for health and dignity of women and girls. So let me say a word about the latest project that we conducted in March and April this year, in partnership with former model, Polish lady Maja Kotala, who created in Mombasa in Kenya, Sewing Together School and project. We, in partnership with her and her Sewing Together project, we launched a program aimed at combating period poverty. Over 200 women and girls in Malawi, located mainly in Mzuzu and Lilongwe, participated in workshops. Workshops were focused on reproductive health, education, but also training, vocational training, sewing reusable pads, both in hand and machine. So the participants also had a chance to learn the basic principles of running a small business. So the introduction that donated to sewing machines allowed us also to create a stable tailoring workshop at our office in Lilongwe that now serves as a workshop for other women, because we already trained women, so now these women can train other women on sewing. And well, this project will allow us also to stable production of reusable pads that will be sold at affordable price, but part of them will be distributed among girls in rural schools who can't afford buying the reusable pads. So supporting these small local women-led enterprises to produce and produce the reusable sanitary pads will stimulate local economy. Yeah? So we both protect the environment, but also enhance the economic independence of women. So this was the first example. Another example of the project that is women-centered is the project called Fruits for Africa. This is the project in enhancing nutrition, food security, generating incomes for women, empowering them, and in the end of the day, protecting their health and improving their potential to access the proper health care. So since 2023, since March 2023, we have communities covered by the project have planted over 11,000 of fruit trees. So beneficiaries of these projects are mainly women. There are some women organizations, youth organizations as well, and people with persons with disabilities as well. So this is not only about protecting the environment and, preventing deforestation. It's also about, as I mentioned, food security, but it's also about women empowerment and enhancing their economic independence. So now women just having the source of income, because part of the fruits goes to their families. Part of the fruits will be sold, so they will have profits, and it will enhance their domestic budgets, and at the same time they'll be able to go to the clinic when it's needed, to pay for the healthcare, so also to pay for their children's education. So this is the project working on many different levels, and it really works. Another initiative was also collaboration with one US-based organization. It's not our own project, but we are the local partner of the project, focused on providing women with solar cookers and solar pumps. So solar cookers, it is also a project that is focused on health issues, yes, because it reduces respiratory diseases, and it enhances the budgets, it decreases deforestation and carbon emissions, and of course, once again, empower local women through income opportunities. By providing solar pumps, we enable farmers to increase the number of harvesting. It's also because usually, for example, when it's with the field of corn, you can harvest once a year, just depending on rains and natural, seasons. But with irrigation, that is with solar pumps, we can harvest twice or even 3 times a year. So it is all about increasing the profits, and at the same time enabling women to access the proper healthcare, to get the proper healthcare. So a very similar project is also so-called Zomba Enterprise Fund, or we call it also Kamkuzi irrigation site. We just, thanks to the grant, we bought a piece of land where we plant corn, and the profits from selling the corn will create a budget that will enable us to invest in healthcare of women on Chizi Island, because Chizi Island is a place that is very much neglected in Malawi. There's also one devastated health center that we equipped already with the so-called boat ambulance. But this is our way to create a fund that, together with the communities, we will use for the basic needs in terms of women and children healthcare. So I think that these are some examples that show our commitment to be very environmentally responsible in what we do. By the way, it's worth to mention that every project that we would like to submit to apply with for a grant or any funding, every NGO knows that one of the basic components is if this project doesn't harm environment. So this component is very, very important for us. And every time we design it, once again, I would like to emphasize it's also done with the communities, with the local people. If we create something together, we always take care of the environment. And well, so this is what planetary health is all about, right? Yeah, I think, thank you. This is what I would like to tell you about.
Oh, this is amazing, Alina. So many. So I think when we hear you, we can see that the projects have to be like multi-factor, no? So every project you talk about, I'm sorry, um, have different have a domino chain, no, of consequence, and that can provide for women and also for the community. And I love fruits ones. So what
Yes,
kind of fruits?
we yes, Fruits for Africa. It's called Fruits for Africa because it is not planting trees, just trees. In the communities where we work, we were told that it has no sense to just plant trees because with all challenges that people face, with time they may stop taking care of seedlings. When we plant fruit trees, this is totally different story. Yes, and the results are much, much more profitable and excellent for the community. When we were in Tanzania, by the way, let me add just one sentence. It was also a project related to period poverty and health, right, of women and girls, especially girls. We wanted to support girls in Moshi, in the secondary school in Moshi, Kilimanjaro region. So we raised some funds for reusable sanitary pads, but we decided not to buy it here and bring it to the girls. We bought these pads from Maasai women in one Maasai village, where they started a kind of micro social enterprise and started sewing reusable pads. And we went there and bought these pads from them to provide them to the girls in Moshi. And additionally, we also supported Maasai women with our sterile birthing kits, so-called mama kits, because they had issue with infections during childbirth. So project is not only just it doesn't work always on one level. Yes, we try to make it really really complex and working on many levels.
Oh, this is beautiful, amazing. Alina, I'm going to invite Ellen to start her speech, and then we can open for everyone to ask questions for both Alina and Ellen. So now we have Ellen. Ellen is a very powerful woman from Uganda, and she is a founder of an organization that takes care of women and girls. So I'm going to let her talk more about her project and the impacts on that. Ellen, please. Where is she? Oh, she's here.
Hello, good evening,
Hello.
everyone. It's a pleasure to be hosted here. My name is Helen Donkuse Tanyenga Waiswa, and I am the founder and executive director of YORGHAS Foundation, an organization that works with women and children who are survivors of sexual gender-based violence, trafficking in person, child labor, and modern-day slavery. It's really a privilege to be here because all this, in the end of the day, you look at it, it is an issue of, in the end of the day, there is an aspect of health in it, where we realize that either women during, for example, during climate change, like, let me say flooding, women become so affected in a big number. I would say that most of these catastrophes, when they happen, 80% of the people that are affected are women and children. And because there is a need to host them, they become desperate for shelter. Today, I was discussing a topic with one of our doctors, and we're speaking about how girls are used in sports. And I was telling him the desperates that women go through, and some of them are looking either for food or shelter. So just imagine a situation where women are experiencing environmental, there is a flooding, there is an earthquake. Who will be desperate for accommodation? Most times are women. Because first of all, back here in Africa, a woman owning a house, it's a chance. It's a chance, it's luck. Actually, you're born lucky. You're almost a princess because you own a house. It's something that is really not common. Even when you own, there are certain laws that can retrieve you away from that house. I have experienced this when I was working as an intern in a court, whereby a woman owned a house and the children and the father ganged against her because they believe a woman shouldn't own a property. So YORGHAS Foundation works with the women and children to make sure that they have ownership. They have the ability to own up their own life. We help. What we do legal aid. We do emergency responses, whereby once a woman has been defiled or a child, has been raped, a child has been raped, we take them through a system that is decent, away from embarrassment, away from feeling ashamed, whereby we hold the perpetuator as the main shameful person in this category, whereby, because our communities look at the person who has been raped or defiled as the shameful person, your dignity is lost. So how do we make the perpetuator feel undignified, doesn't have the value in the community? So YORGHAS Foundation works in such projects, in such an angle, whereby we do legal aid, emergency responses, safe spaces. We create safe spaces for those that are in need of it. We do vocational training. We do empowerment programs that have an aspect of climate adaptation projects, what we call green products and green processes, green practices. Among these, we have the solar projects. And in the solar projects, we do have a one-stop center, I would say, or a village, whereby all these, it's a model village where we are studying the variance, how women can develop within having everything on their table. For example, whereby women spend, it's estimated that women spend 200 hours fetching water and firewood. What if it is put in a local community? What are we going to save? And this has been done in one of our projects called Wicherimba through our funders and sponsors called Solar Electric Light Fund. And what we've achieved out of there is unimaginable, whereby years back, women, inclusive of myself as a child, as I was raped, we could walk distances to fetch water. But now the water is at source. And then you realize that girls are not getting pregnant because that ample time that is wasted between 6 p.m. to 7 as you're fetching water, the perpetuator is there, the boyfriend is there, is not there. Children have water at their home. Children have time to read. So what I'm talking here, that we have girls who are skilled now. Either they're attending school or they are at home baking a cake for a graduation that is taking place. And then you realize that the streets are safe. There are street lights where women are walking in safe hands. Even things like murder are limited, rape, theft. So you realize that we created a community, one of our projects that protects the people, especially women and children who are vulnerable, either to go to the trading center to buy something at night, or sugar, or fetching water or firewood. So YORGHAS Foundation has created holistic environment that protects women in different areas. So as we speak now, we're extending our water pump solar pumped water to another village. We are, reciprocating the procedure, and we are learning from it. And our story is that we can do this all over the country, so that women are able to stay at home and fetch firewood. Our YORGHAS Foundation has a one-stop center idea, whereby women are protected from all these, I would say, from all these evil, or in the way our cases are handled when a woman is raped. So it has gone ahead putting out clinics whereby a survivor can get all what they require to get tested, and DNA, the court proceed. Sorry, not the court proceedings. The police. What we call, how do I call it? Sorry, my phone, my laptop keeps acting. So YORGHAS Foundation has a vocational school, whereby, as I speak, at the office of YORGHAS Foundation, we host over 150 women a week. Among them, they're learning bakery, tailoring, knitting, weaving, and most of these are survivors of sexual gender-based violence. Either they're teen, as young as 14, but she has a child, she's a mother, and she's so vulnerable. So we teach them all these the skilling, so that she's able to support herself. In that way, they have also learned to make their own renewable usable pads, reusable pads, so that they do not spend a lot of money buying pads. YORGHAS Foundation has sent children to school from vulnerable women, especially young mothers and single mothers who are struggling, of whereby we have successful stories to make sure that, as we speak now, we have a pharmacist, we have a doctor, we have a nurse, we have a designer. Why? This, in the end of the day, it relates to health. These women are able, these women who are single mothers are able to survive through the support of the educated children. The children are able to go to school, and they're able to come back and empower their own family. And then the mothers are also being empowered through adult education, and then also the hands-on skills and all that. They're able to get better foods. And then also the better farming methods that we put in place. For example, we have the home gardens. We've set up vegetable growing. Even when you come to our office, to all our offices that we have gardens. We teach women how to make simple vegetables that are nutritious. Then also we do farming. YORGHAS has done a lot of poultry farming, all sorts of farming that involves rearing of animals for either sale, because women are able to sell maybe a cow to send a child to university. We give a goat, we give a cow, so that they can resell. They keep reselling, so that they're able to send their children to school. And also what we've done is that we've planted a lot of forest. YORGHAS Foundation has hectares and hectares of both typically indigenous, and then the eucalyptus, and then the pine. For the pine, we do the microcredit, green microcredits, whereby we sell and then it regrows and like that. And then for the natural, it's for preserving of environment purely, and then also to make sure that we're able to send more people to hospital. We are able to send more people to school. We are able to empower women in all angles of life and children. So what we do is that we make sure that the project itself, as a foundation, is sustainable. We look at sustainability of the organization, as well as empowering others and giving them a better health environment. That is what I can say for now. I will keep on adding as we continue.
Oh, that's wonderful, Ellen. And I see so many similarities on the project that you are doing and Alina. So it's both multi-task, multi goals, projects, and
Holistic, Renata.
holistic. I love that. Holistic. Thank you. Yeah, that was the word that I was missing. But that's true. And when I see, so today we are in the seventh week of the Planetary Health Coalition, and last week we talked about water. Maria is here, and
Yeah.
and then when we talk about women, we talk about water again, and we are going so because it's all related, you know. I wish we can have like one day all the sessions together, like because we are all interconnected, no? And that's planetary health, interconnection, you know, between different fields. Because people not normally relate rape to water, you know, and it's completely related. We know that. So, but from the people that doesn't understand the context and the reality, say, wow, why she's mixing everything? Because it's all related. So now I would love to open for questions. If anybody have question, please raise your hands. And oh, Elisa, please.
Hello, everyone. Thank you, Helen and Alina, for sharing your work. I would like to pose a question to both.
Just a second. Tell them where are you zooming from.
Okay, I am Elisa. I am zooming from São Paulo, Brazil. And I have been joining these sessions every time I can make them. I can make it. So, Alina and Helen, I was reminded this week of the work of Dr. Gabor Mate, who is a Hungarian Canadian physician who has a lot of experience working with trauma. I think he has more experience working in the Western world, in the global North. And I was reminded of him saying this week that 80% of cases of autoimmune disease that he sees is in women. And I was hoping that, wondering if you have ever seen anything either related to that part or to to other underlying conditions. And what brings me to ask this is perhaps a wider concept of intersectionality or of compounded trauma, where there is more than one factor affecting you and bringing you challenges, and then another challenge comes, and that is all usually faced within a context of several factors challenging you, not just one, so I was hoping you could share if you have seen either on the health of people or on other aspects, but where you can talk about these compounded effects, or this either through intersectionality or the repetition of the same factor, but then coming back and affecting us exponentially. I don't know if I've made myself clear, because it's a rather wide question and I'm asking you to connect it with different things, but I hope it is sufficient. Thank you very much.
Thank you, Elisa. Helen, would you like to answer first?
Let me do that, but honestly, I didn't get the first part properly, Skippy. But was it about women being affected more with immunizable diseases?
With autoimmune, the comment from Dr. Gabor Mate was specifically about autoimmune diseases. Diseases where the body is attacking itself. And he was relating this with, associating this with being more common in women, because women in the societies in which he was working
definitely
were to be that they are responsible for the happiness and well-being of others, and so and not necessarily expressing healthy anger and so many other different parts of behavior that we are taught and that we adopt, and that could be actually result in a price that is silent and comes much later. And I was hoping that you had seen anything related to that, but if not autoimmune, then other aspects of how, because of the conditions in which we are facing the challenges, perhaps there are actually compounded challenges and compounded effects. I brought this first with the context of the autoimmune diseases appearing 4 more times in women than in men, at least in the context of his work. Thank you.
So
Thank you so much.
I just want to
yes,
add something here, because I don't know if everybody understands what is autoimmune. So autoimmune can be a simple allergy, but can be a cancer too. It's a huge range of diseases that, our body can develop, and normally it's related to stress and and pressure. Yeah, go ahead.
Oh, thank you so much. Thank you so much, Elisa. Definitely, yes. Personally, I have I would give an example. Right now, most of the autoimmune diseases that, I'm sorry, I'm not being gender insensitive, but that catch men, it's because of the lifestyle, whereby women do not have this choice. A woman is at home taking care of the children, the grandmother, the uncle, the dad. So it's because of the pressure at home that is surrounding her. As well as for an African man that I know from Uganda, not being selfish, it is because he has gotten a lot of money. He's going to go and get women. He's going to go spend money to this, that pressure, because maybe a girl has refused. So we the problem of, apart from the children, but for the problem of men and women here in Uganda, it is totally different. A man gets pressure because maybe even losing a job, but these are rare cases. But he has put himself into a cocoon of 10 women, all of them demanding to get something out of him. So this puts his life at stake. As well as for a woman, it's not a choice, it's a must. You have to take care of yourself. I have a friend of mine, she has Parkinson's disease in US, but she has to take care of her husband and their son, who is autistic. She's always falling and ambulances are coming to pick her all the time. So yes, that is very true, because as I speak now, I have seen it through my sisters. She either struggling with the leg, she can't walk because she overwalks, or she has high blood pressure. The children are not going to school. Someone has not paid. Someone has not played his role. Now she has to look for the tuition. She has to see the children are being fed. So with all this pressure, definitely, the health has to deteriorate, and this starts with the stress, and then you get diseases like Alzheimer, you get Parkinson's disease, you get high blood pressure, you get numbness in the hand, a lot of things and the challenge we have here in Africa, besides the global north, is that most of these diseases are related as witchcraft. So you find that instead of someone getting medication, she will say, like here in my country, if I touch my son-in-law, and they assume that because of shaking of the hand, it's because of that. So they feel like you either cheated with him. So they start accusing you. She might have slept with the son-in-law. So you're compounded into pain. No one is willing to treat you because they're giving excuses. They're not giving it a chance to go medically or to do research on health, what is happening. So you're left and abandoned. Certain diseases, you're possessed, you're sick, you're evil, you're a witch. So you find that all these aspects, people cover them up, and the women still struggle. And that is true. You'll find that 1 in 4 women is suffering from either diabetes or Parkinson's disease or pressure. That is true, yes.
If I may add something, Elisa, thank you very much for this question. This is very interesting, and I think I will have to look for some data, because honestly, I don't know the details. I'm not a physician, but I don't know data in the countries where I worked or I'm working now, regarding the number of autoimmune diseases and its connection to the level of stress, to living conditions, etc. I personally I agree, it must be linked. But, you know, we work with communities, with vulnerable women and girls whose main problem sometimes is just related to menopause, for example, is a fear. It is fear that when they are 50 plus, their husband will go away. And that was their first concern, you know. So just to give you a picture of the difference, because we can somehow gather data, we can check it. Yes, we have scientific results, and we simply check it in our part of the world. But in these communities, it's very very interesting, and I would try to find some data. However, you know, if there is a choice, for example, for a woman to buy safe birthing kits protecting her, for example, from infections during childbirth, or to buy food for children, this is the world we work in. So I never even asked about autoimmune diseases. I never asked, because there are so many problems, issues, and challenges on the ground, that this is just like something that we never even discussed. However, it is important, and I find your question very interesting. I would love to get back to this topic one day. Thank you.
I just want to add here something. 25 years ago, I was doing residency in, my first career was a pediatric nurse. And we started to see a lot of kids with autoimmune disease. And we started to study in adults' book, not, pediatrics anymore,
Yeah.
because the kids were having adults disease because of the level of the stress on the kids. So yes, and I remember when I was in college, like the other century too, we used to relate a heart attack to men, but as women start to get in the work field and have build responsibilities, we started to have more and more heart attack too. So the life, the way we live life, it's really related to the disease we develop it. It's like that. Yeah. And I understand what Alina said, because I work in several projects in Africa, and it's very different from the epidemiology I saw in Brazil, because I agree with her. We have so many more urgent things and it's more difficult to get the diagnosis with some autoimmune disease, that it's more difficult, much more difficult even to diagnose. Yeah.
Right now, may I say something? Sorry.
Yeah, sure.
Right now in our office in Lilongwe, there are doctors from Poland. It is a medical team who came for 2 weeks to treat patients for free. So you can't imagine the lines. We were asked to just allow 24 to 40 patients per day. Every day when they come and they start early in the morning, there is 50 people waiting for them at the gate, and later another 70 are coming. And this is just, general medical care and dental care in the second office. But this is free. They have even ultrasound. But even there, they are not able in this environment to treat everyone with every disease. But I suppose there are many patients with autoimmune diseases there. But when something, for example, going with hair or with the skin, in the rural, remote village, nobody cares until it's not threatening, it's not a matter of life, a life or death. We have just to remember it's a different angle, yes, and a different perspective sometimes. However, diseases are everywhere, allergies are everywhere, autoimmune diseases are everywhere, and I will be I'm really interested in the results and in the report after our medical team ends this project, because I will get more data from this report and I will know better the health condition of the community we work in.
And the interesting thing about communities that have a lack of access, they see disease as equal as pain. If the silent disease that there is no pain, it's so hard to see.
Diabetes, for example.
Yeah, even some types of cancer, it doesn't hurt. So it's really hard. But you talk about dentist. Dentist is the first thing because it's a lot of pain.
It's a pain.
So it's so.
Yeah, it is. You mentioned lack of access. It is like a key word, because even when you talked about water scarcity, yes, the problem with water is not a lack of water. Very often in many countries, it is lack of infrastructure. So this is lack of access to infrastructure. This is the same in health. Sometimes people they know something is going on with them. They are not right, but they have no access to a medical facility. That's it. They have no access to skilled, health personnel. There is no road to reach the nearest hospital. For example, it is rainy season. They don't have cars. How they can get to the hospital during the rainy season? They have just to stay at home and wait and pray. This is the reality of millions of people nowadays in the world we live in, where when Tesla somewhere in the space is flying and many companies spend millions of dollars for things that are not necessary and that we don't need, yes, and at the same time children are dying from preventable reasons. This is the world we live in, and this is probably the reason we have met and we are talking, just to try to do something together to make this world a better place, just a little bit, a little bit.
And you talk about the rain season. In Amazon is the dry season because the roads are the rivers. So if you don't have the rivers, you cannot go anywhere. So the context is very, very important to understand, to create projects and things like that. And I think Dario raise your hand if you wanna ask a question, please.
Thank you. I'm Daryl Mbewa. I'm from Kenya. Hi.
Yeah.
Currently, I'm working. I'm the chair of an organization called Elevator Foundation. Here in Kenya, the Elevator Foundation mostly deal with just supporting the vulnerable girls and caregivers of children with disability. So we have a lot of activity that we're planning to do. Actually, just want to congratulate Helen and Alina for what they're doing. It's just almost similar to what my CBO is doing. I know we had met with Alina in some forums, and we actually were planning to have some meeting with her because of what she's doing. Just actually the same with what my CBO is doing. As much as I'm a man among the project that is being run by women, but this is because I have 4 girls and 1 boy in my house. Those are my children. So I think I'm more near ladies than men. So Actually, the project we are doing in I started with my wife actually. Time when I'm at work is the one who has uh, of the girls running the program, but I give mostly all the support that is needed. The CBO is still young, and I hope that it will go with the time. And being here, I think I'm meeting the right people. Maybe if we collaborate, then you'll help me to move it to the next level that it should be. Yes, as Alina said, that we are here to make a world a bit better. I'm here just to make my community a bit better than what it used to be. And that's why the reason why that I came up with the CBO. Actually, we are also doing the reusable sanitary project, though we're not still very perfect in it. We're just on the process, and I know maybe by next year we shall be producing some that can be used and some that can be sold, so that the girls can get some little income. Most of the caregivers that I work with are. The young girls who have the children with like maybe cerebral palsy. And when you give birth early and you have a child with a disability, everybody sees you as a burden. So I thought of why can't I just bring them? They learn the sewing skills. Apart from that, there are a lot like maybe just hairdressing, just like what Helen was talking about. And actually, we are also focusing on agriculture. We are thinking of doing the poultry, though still we don't still have resources. But those are some of the things that we are thinking. The little thing that they can, after learning from the CBO, they can go back home and do something for themselves to make them maybe be productive. Because when you are not productive, everybody see you as like just maybe as a burden. So we want to make sure these ladies in the community are productive. Again, they have a football team as well. They always play the football. Yeah, because I know this young girl with the football, it's it's like apart from just the physical, the physical and mental health is just one thing. So, and again, it's always bring them together where we try to nurture them like being like leaders again. And again, apart from that, my wife do like the mentorship, teaches them the real life situation, how life is of a girl when they're growing, what they expect to meet in future. So it's a lot. I know maybe I'll be able to share with some of us who are who will be maybe supporting me in this. I have the objectives are there. There are a lot. So I think when we share, and maybe you may have a friend that may support some, so that we make my community a little better place for the girl child and the vulnerable women to live in. I wanted just to add something on the autoimmune diseases. Actually, professionally, I'm occupational therapist. I know Renata, what OTs deals with. Generally, we focus on the functionality and the productivity of a human being, and that's why maybe I'm more interested in making these girls to be more productive in the community. So. What I've experienced with the women with the work, like there's something we call cumulative trauma. I think it's something that really affects them. Like in Africa, most of the women are the one who works, be it the farm, be it where, and again, they don't know the right position that they should assume when they are working. So this one can actually impact uh, their productivity in a negative way. This is what I think I'm just trying to relate it with the question that was asked about the women and the autoimmune diseases. Then maybe the positioning, then maybe post-birth, after delivery, how the women do their activity actually can also impact their life in a negative way. So it's a lot. And I think maybe one day when there shall be some discussion about this, I would actually like to be so that I get more and also I share what I've learned maybe in the field. I think I don't
Dario,
want to take much time. Yeah,
I don't want to interrupt you, but we don't have a lot of time.
yes,
And
so that's
I
what I
can
was saying.
see
Yeah.
Ellen and Alina with raised hands. I just want to thank you for sharing about the community, the project in Kenya, and ask everybody, please, to put your contact in the chat, because one of the goals of those meetings are, creating collaboration. And I think we have a lot of problems in common. So how can we learn together, to achieve all those issues? Helen, please.
Thank you so much. No, I just wanted to add on what we're discussing about the scarcity of the medical facilities. For example, back in my community, you find that only health centers, typically either health center 3 or health center 4, so they do not have equipment, even a scan. Even going only for a scan, you need to go to a bigger hospital or a private hospital where they will charge you a lot of money. So I just looked at this area and I was like, really, how will a lay person back in my community know about autoimmune diseases? They will not. Someone will die. Most of the time, people are diagnosed of cancer at the later stage. So, as we are gathered here today, it's something we should think of. How do we lob the government to come and emphasize health sectors to be really empowered in our community, because you realize that women are dying, children are dying for diseases that could have been manageable earlier, but we do not have options. So yeah, it's something I thought about and I said, okay, yeah, it's really important, because right now, if a woman wants to give birth, it's raining. What is she gonna do if the cars are not there? She can, I remember some time back we tried to do the mobile ambulances, but how would you push someone in a muddy road? So those are some of the challenges that, yeah, we are really facing. Thank you. Just an add-on.
Thank you, Helen. Yeah, access is everything. Yeah. Alina, please.
I don't want to take time, but I just wanted to add, because what Daryl mentioned, women with disabilities, persons with disabilities. Of course, I couldn't talk about everything that is in our plans and the project that all projects that we want to conduct, but this is a very important issue, because when it comes, for example, to maternal health, women with disabilities are just left totally alone. For example, in Malawi, but I guess it is the same or similar to many other countries. So what I would love to do, to create, would be a program for health facilities and in general for the Ministry of Health, a program that will just include women with disabilities into this healthcare system as patients, simply as women, because it is not only physical like disabilities. We also have to remember about women with mental illnesses. Yes, very often they get pregnant because they are victims. And then when they go to health facility, they are treated like, a second sort of people, that they don't deserve to be mothers, and they are victims again. So there are no leaflets, no materials for blind mothers. There is no one in the hospital knowing sign language to explain some things to deaf mothers. So this is also another holistic program to think about, but just a thought. Thank you.
Yeah, for sure. It's the lack of access is for everybody, and even for people that have more needs, it's even more difficult. So I don't know your name. It's just say 1, 2, 3, 4. So you have a raised hand. Do you want to ask a question?
That's Walter.
Oh, that's Walter.
Yes,
Walter, welcome. I couldn't see.
Hi, Walter.
Thank you so. I'm sorry. Thank you so much, Alina, Renata, Maria. I see my friends, Helen, Darren, and everybody. Thank you so much. We are here again this week, and I am from Kenya. Yes, we are here again to talk about the women empowerment programs and how women can have power to take control of their situations.
Yes.
We thank you, Renata, for bringing this discussion. I believe this is a global discussion, and we are going to look at it in the global manner so that we can come up with global solutions. Yeah, the question we must ask ourselves is, why do we discuss this important issue in a global platform? The reason is that women, in most occasions, our focus become women because they are the most affected in every situation, every scenario, in economic turmoil, where there is no peace, when there is hunger and everything. They are the women who actually suffer most. We have situations and we have several experiences in our areas where we come from. But our focus now should go directly to solutions. When we meet at the global platform like this now, we need to come up with structures that actually run from the global level to the country level and even to the community level, so that we have that clear network, we have that clear collaboration, so that whatever is happening in Uganda at a certain community in Uganda is actually being highlighted to the level of the global arena, so that Renata will know what Helen is talking about very clearly, because there is that connection. So what am I talking about? I'm talking about a structure which we need to build so that we have collaborations and networks, very strong collaborations and networks, so that we cannot do these activities in isolation, because we will find ourselves burning out at the end of it. You will find Alina working alone wherever she is, in Zambia or Malawi.
Malawi.
Okay, exactly, in Malawi. And you will find another person doing a similar activity in Uganda or in Kenya, working alone in a total isolation. So if we meet at this level, at this platform, we need to form a collaboration. And this is why, Renata, I thank you so much, because we are going to discuss this. And we will even discuss this outside this platform, so that we come up with solutions, so that we know what happens in which area and how it can be tackled. We can help one another. We can give hand to each another. It's not about money all the time, but it's about sharing ideas, and we can come up with the solutions. So this is very important to me. And this is very important again, as I say, because the power of women, or the power now lies within the women, because they are the people who are getting affected, as I was saying already. So another thing that I want to bring to our people, so that we can also, because I'm working in the same sphere. I mean, the same frame. What I want to add is that we need to look at how the women can come together and gain the power within our communities through influence policies, the government policies. Here, women can take in community meetings, because it's the community meetings where meetings are called. For example, in Kenya, when public participations are called for policies to be made or to be changed, women stay at home. They don't go to those meetings. So at the end of the day, their ideas, their intentions are not captured in those. So at the end of the day, there are only men who are talking. There are only men who are participating. So we need to have more women involving in lobbying and advocacy, so that we can have strong policies that protect women and children. Men don't care much, but we find ourselves, some of us actually care much about what women go through. So I think we will be building this, and I think it will be a good idea. Last time I talked about water. I won't talk about it anymore, because we are now starting to at different levels, and I don't have much to say. But now, thank you, Alina, and thank you, Helen, for having introduced projects that will generate income for the women. Thank you so much.
Thank you, Walter. And I think, I think that's so important to do what he said, because when we talk about innovation, I think the innovation will come from the people that are in needs because they know what they need.
Yeah.
They know what, you
Exactly.
know, what they have to create. And of course, I totally agree with you, Walter, that we need women in the decision making, no? So that's one of the goals to have this platform and discuss that, because for sure we need collaboration and we need to raise the voices of the woman because it's very silent yet the voice of the woman. And so how we can support women to talk, to speak. And Maria, I'm going to let you, and we have to
Just for
And
1 second,
yeah.
can
there
we
is
all
one
go
thing I
away
want
and
to add.
think?
Can
Sorry,
There is
Sorry.
one
please.
thing I wanted. There's one thing.
Go, go,
One
go.
thing I want to add. Please, can we support women to have elective positions so that they can take our issues to parliament, to areas, to the government institutions that are that can change laws and make policies. So we need to support our men, and they need to take part. I would like to see Ellen being elected an area member of parliament in the next few coming years, so that these things can go directly to the government and they can push for the laws made in parliament.
But Walter, girls can't be raised submissive, so submissive. These are cultural factors that let girls keep silent and let women
Yes,
get
and
voiceless. That's the
ex-
problem. We
and
have
that's
to
exactly
teach. We have to teach boys. We have to teach boys and
exactly. These are the
educate the
things.
men.
Sorry, I hate to be in this position because the discussion is so interesting. I will let, yeah, because we can talk
Yes.
forever here. And I just want to hear Maria, and we have to close,
It was
unfortunately.
just a challenge, really. What does it take to get the women to be able to be part of this? What is it? Is it educating boys? Is it educating men? We can continue this conversation. It's important. And yeah, just a challenge really for us to think, how can we change things in that way?
I love that. So we finished today with this powerful question: what can we do together to change this reality? So I think it's to any one of us think about that and get together and discuss more, because I don't have the solution and I think nobody have, but together we can find the solution.
Yeah.
Okay, so I thank you so much. I appreciate these beautiful ladies that come. And also, it's great to see men in this discussion. This is really important, and you are very welcome too. Okay, thank you so
And
much.
very supportive men.
Yeah,
Very supportive
yeah,
men, yes.
yeah.
Exactly.
Wonderful men doing wonderful projects. Absolutely.
Yeah. Thank
Yeah.
you,
Thank you.
guys, to be with
Thank
us.
you.
you.
Thank you.
Thank you, Renata.